Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. Today we're talking about male infertility. Doctor, what is male infertility?
Well, infertility is defined as a couple's inability to conceive over 12 months of unprotected intercourse. And this can affect up to 15% of couples. Male infertility is the male components or factors that can lead to the infertile couple. And we think that about 1/3 of cases of infertility are mainly due to male factor, and up to 50% have some component that is secondary to the man.
How many men suffer from infertility?
It's a good question. We think about 1 in 6 couples, or 15%, can suffer from infertility. And so if you do the math out, that's about 2.5 million American men who may benefit from an infertility evaluation.
What causes male infertility?
There's numerous causes. They can range from anywhere from sperm production to hormonal causes, genetic causes, surgical outcomes, obstruction, and even lifestyle choices or medications that are being taken.
What are the symptoms of male infertility?
So that's a good question. Most infertility is really not symptomatic, which is why getting evaluated is so important. We recommend that any couple that's been trying to conceive for 12 months be evaluated. And those couples at higher risk get evaluated sooner. So that might include a man who's had surgery on both his testicles, or a couple where the female partner is over the age of 35. Traditionally, females have led the way in terms of the evaluation for fertility. I think mainly because they tend to talk to their gynecologists about this issue. But we know that the male infertility workup tends to be less invasive and quicker. And so it probably makes a lot of sense for men to get evaluated early on in the process.
How is male infertility diagnosed?
The main diagnosis of a male infertility comes from a thorough history and physical exam with a doctor, as well as from a semen analysis test. A semen analysis is a sample that's given by the male and is non-invasive. It's looked at under a microscope, and it helps us to determine the sperm numbers that are present and their function. Once we know a little bit more from that testing, occasionally further testing is required, and that's usually non-invasive blood work.
How is male infertility treated?
There are a range of treatments that can go from lifestyle and behavioral changes to medications. There are some surgical treatments, and then advanced reproductive techniques. Things like intrauterine insemination or in vitro fertilization are required in some cases.